Hi, my name is Dr. Story. I've been a chiropractor for over 24 years. I'm going to give you some realistic advice based on my experience. A common topic right now, and quite frankly every 4 years, and patients ask this all the time, is what do you think about national health care, Dr. Story? Well, in this video, I'm going to give you the exact details of exactly what I think. So let's get started. First of all, when patients ask me, what do you think of national health care? I'm in America, and I realize that with YouTube, you may be watching this, and I'm curious to have your opinion. Why don't you put a comment down below letting us know how your government or your country provides health care to its citizens. Is it free? Do you pay $200 a month? Do you pay whatever? How did they do it? So this will be informative to people outside of America, and also maybe we can have a reasonable discussion in the comment section down below. So what do I think of national health care? I think it's fantastic. I think it's a great idea. However, then I ask my patients, so how do you think we should pay for it? And that is the problem. So how do we pay for it? Now, right now, currently in America, we do not have national health care. But we actually do. We just don't call it national health care. So we have national health care, but it's only for people over the age of 65 and people that are disabled. And it's called Medicare. And the million-dollar question is, well, why don't we just do that for everyone? And the answer is because it's not really working very well. Here's how Medicare works. If you have a job in America, you're going to get taxes taken out of your paycheck for the Medicare system. And that goes into a little pot, so to speak, for Medicare. Then your employer also pays into the Medicare system. So what ends up happening is we have people that are employed paying for people that are not employed. So you have a group of people that are over the age of 65, or they may be disabled and under the age of 65, and they are receiving, we'll call it national health care, and the people that are paying for it are the employed people. Well, 50 years ago, that really worked really well because there was a tremendous amount of people that were working, and there was only a small amount of people that were not working. So you could pull a tremendous amount of money, and I'm just throwing numbers out there, but if you're a business and you could pull in $3,000 but your expenses are only $500, then that can seemingly continue essentially forever. The problem is, a couple years ago, all the baby boomers grew up and became 65, and what happened is this small group grew bigger and bigger and bigger. And when unemployment goes up, which means less people are working, you have less money to pull from the Medicare, from the employed people. So now you've got a situation where, and again, I'm just throwing numbers out there, if you were a business, like Medicare is, you're bringing in $1,000, but your expenses are $10,000. Well, that's not going to work for too long. Of course, you can steal from other places. In government, you could take money from one resource and put it into another, but essentially you're stealing from Peter to pay Paul, and that doesn't work forever. So keep in mind that when people are saying, what do you think about national health care? We do have national health care. In addition to that, we actually have a health care system for people who are poor. So this concept that we're just going to let people out onto the street and die is not really accurate. We have in every state something called Medicaid, and if someone is unable to pay for medical services and they qualify for Medicaid, now in California it's called Medi-Cal, but essentially it's Medicaid, then they qualify for that and they get free health care, so to speak, but the people who are paying for it are the people paying the state taxes. So the question becomes, how do we pay for national health care? How would we take a system, for example, like Medicare, and how would we do it where everyone gets national health care? Everyone gets something similar to Medicare. Well, the answer is you have to have some money to do it. And where does the government get money? Most patients are taxes. Exactly. So if you want national health care as a patient, which I personally would love to have a system where everybody's the same and we all get, seemingly free national health care. But the answer is we will have to pay taxes for it. So if you were to agree to pay more taxes, then in theory the government could take that money and put it towards health care. The challenge is, if I wanted to run for president, and I stood up on a podium and I said, more taxes, free health care, I'm not going to get elected. A lot of times you have to say, read my lips, no new taxes, or we're not going to tax you. People think that somehow we can have free health care, but the government will pay for it. Well, but the government just can't print money and just seemingly have free health care for everyone. They have to get it from somewhere. And so it would come from us, the patients. We would be paying for it. So if someone were to stand up in front of a podium and say, I'm going to tax Americans, everyone's going to pay 60% federal tax, and that way we'll have free health care, I don't think that person would be elected. So the question is, well, then how could you do it? And I've come up with solutions, and here's what they are. The first is tax people in a way that they won't know they're being taxed. So right now, currently, and I'm just using me as an example, I pay around $2,000 a month for health insurance for my family. And we have, I believe it's a $7,500 deductible and a $15,000 out of pocket. So what that means, if you're not familiar with that, is I pay $24,000 a year for the opportunity to have a health insurance plan. And that health insurance plan doesn't pay a dime until I've paid my deductible, which means I have to pay the first $7,500 or something like that. So it's not really $24,000. It's more in the neighborhood of $31,500, something like that. So I have to pay $31,000 plus dollars before the insurance really kicks in, so to speak. Then, once the insurance kicks in, I have to pay a percentage up to a max of $15,000. So in theory, if I really do some doozies and get injured and have multiple surgeries and multiple problems, I'm looking at the neighborhood of I will probably spend only $15,000 above and beyond the $24,000 for the opportunity to have insurance. So I'm well aware of what I pay for health care. Now, if you were to offer me a plan that was seemingly free, that would be awesome because it would be saving me all that money, right? But where does that money come from? Well, you have to tax someone else in order for me to have the health care. But since I'm a patient myself and I'm employed, I would be taxed too. So if they had a health insurance tax, we would all know what we're paying. The problem with that, when the government does that, is we would all know what we're paying, and we don't want to know what we're paying. So another way to do it would be to tax things where we would not know we're being taxed. So what you can do is you can add 0.5% of tax to homeowners. So if you own a home, suddenly your tax would go up. You think you're actually paying a homeowner's tax, but actually you're not. You are paying for federal tax. So they would take that money from your homeowner's tax and put it into healthcare. That's one way to do it. The other way to do it would be to put tax on certain foods. So we could tax Twinkies and Ring Dings, and we could tax meat, and we could tax Pepsi, and so if you buy something at the supermarket, that the government determines is not something you want to be eating, they can add a nickel tax to everything like that, and then take that money and then use it for health care. We could also add 3 cents or something like that to a gas tax. And so when you go to fill up your tank, your gas prices would go up. So this is a case of stealing from Peter to pay Paul without Peter or Paul knowing what's going on. So you could feasibly do that. The idea, sometimes when election times happen, people will say, well, how we're going to pay for health care is we're going to tax the rich, And the answer is, well, okay, that's nobody likes rich people, right? They're the evil people, but usually the rich people are the ones that are creating businesses and creating jobs so that we could work. So taxing the rich may not work because rich people usually can afford better accountants and better lawyers than the average folk. And usually rich people can find ways to be rich, but on paper, they don't look so rich. So we're just going to use a number as an example. Let's say someone says anybody that makes over $100,000 a year is going to be taxed excessively so that we can pay for free health care. Well, if I earn $99,000 this year, then I'm going to find an accountant and I'm going to find a lawyer and I'm going to pay them to find ways to make charitable donations and to have tax write-offs so that I can keep my income below that magical $100,000. So I don't think people quite understand that when you say tax the rich, you're going to have a hard time finding a rich person because there's ways around it to look not so rich on paper. And we've seen examples of that a lot. So let's say that feasibly you could tax people enough, that way we can all have free national health care and all is well. Not so fast. How do we pay all these doctors? Now, I personally am a patient as well as I'm a doctor. And what I've seen in my years of being in practice is insurance companies, particularly Medicare, just seems to just want to nickel and dime you to death to the point where they're paying less and less as time goes on. One insurance company in particular, when I first started in practice, I remember they paid $35 to see a patient. And currently this year, they are allowing $26 per patient. So in other words, in 24 years, my income has been reduced by 30-ish%. So how much lower can we go? I mean, after a while, we get checks from patients' insurance companies. I have one in particular, a patient, his copay is $40, and the insurance company, their allowable amount is $43.70, which I get a check for $3.70. It's almost not even worth cashing the check, but nonetheless, you get these checks in the mail, and it's the way it is. But one way to save and afford national health care would be to find ways and negotiate, that's a fancy word for saying screw them, negotiate doctors to receive less money per procedure. Now, if that happens, what you're going to see is doctors are going to be spending less and less time seeing patients. If I need a certain income and I could see 4 patients per hour, but now I get paid half, in order to maintain my lifestyle, I'm going to have to see 8 patients per hour instead of 4. It just makes common sense. So your surgeons are going to have to work faster. Your primary care doctors are going to have to work faster. There's not going to be much chat time in the office. And you've probably seen this if you're in America, that doctors simply don't have a whole lot of time to talk about the Dodgers or the weather. We got to get in there, solve a problem, and get out. because we're getting paid less per patient. But let's say hypothetically we were able to negotiate with doctors and pay them less. Well, that would reduce the expense portion of national health care. Sounds great, doesn't it? Well, does anybody remember Obamacare or Affordable Health Care Act? First of all, it wasn't so affordable, was it? Unless you were dirt poor. The second thing was, good luck trying to find a doctor that would accept your insurance. So I had this happen to myself. The first year that Obamacare happened, we applied for this special national health care. We were shocked at the price tag because I do have an income, so therefore I'm not considered dirt poor. So the price wasn't that much different than normal insurance, and the advantage was no pre-existing conditions. So I buy this health insurance policy, and what ends up happening is all of a sudden, a couple months into it, I discovered a tumor on my leg. So ring ring, call up my primary care doctor. They ask us, do you have a policy on the exchange? Or in other words, do you have Obamacare? And I said, yes, I do. And they said, well, we will not see you. And then they told me why, and I'll tell you in just a second. And I called another doctor, and another, and another. Finally, I was getting worried because no doctor would see me. They did not want to accept the insurance because the Obamacare plan was to pay doctors literally less than the poor insurance company, the Medicaid and Medi-Cal. And doctors were like, why should I see someone for so little money when I have an entire waiting room full of people with better insurance? So doctors were revolting or boycotting that Obamacare. It was a legal boycott. There's no law that says I have to accept anyone in my office. If I don't like you, this is in my office. If I don't like you, you're rude to my staff, you're mean to my staff, you're mean to me, or we just don't want to accept your insurance, there's no law that says I have to help you. And that's the same in medicine. The only people that were forced to see you were the emergency rooms. And so I was scared. I had a tumor growing on my leg and I couldn't find a medical doctor to see me. So you know what I did? I'm lucky in the sense that I referred myself and I got my own MRI. And you know what I did? I paid cash for it. And I got my MRI, found out what happened, and I stopped payment on my automatic payments for Obamacare, bought a different insurance company, did a lot of this, and then finally saw a doctor and had the thing removed. So, but I had to change insurance companies to do it. So if you think that free healthcare, in the free healthcare system, that doctors are just going to accept this, we may be shocked at some of the consequences. So in summary, the idea behind national free healthcare is a fantastic, wonderful idea. And I don't think it's going to be free. We're going to have to pay for it somehow, whether we're paying for it directly by literally writing a check once a month for X number of dollars, or our employer is going to pay for it, or the people who own homes are going to pay for it, or we're going to be taxed in some other way. But somehow or another, I know that in other countries, the doctors, it's a job. I mean, they love what they do, of course. I love what I do, but I have to earn an income in order to do it. So I spent 9.5 years in school to become a chiropractor. That needs to be reimbursed somehow. Student loans don't get paid by themselves. So the last thought is, if you're going to pay doctors, if you're going to reduce the price on doctors, the national healthcare system is going to have to find ways to reduce the cost for the doctors, because the administrative requirements to run an office has gotten insane. Like I said, that insurance company that wants to pay me $26, the paperwork is insane. The administrative work that it takes to get that $26 per visit is insanity. So you have to hire people. Well, if the state requires that you pay everyone a livable wage, that even the person who just stocks the back room or files, the high school kid, needs to have a minimum wage, but it needs to be so high that they could literally have an apartment and a car and a 401k. You know, you have to control costs. The other cost, the main cost for a lot of doctors, is malpractice. The ability to sue doctors at the drop of a hat. If you get a little bit sore from an adjustment, anyone can sue me. So the rent goes up. The administrative costs go up. Staffing goes up. All these things continue to grow. So if you have a certain income and your overhead is here, but your overhead keeps growing and then the income goes down, there comes a point at which no doctor will want to work. No doctor wants to do that. So if you're going to pay doctors less, you're going to have to help doctors control costs. So in other words, if my income goes down for national health care, I would expect my cost to go down as well. So I'm very curious again. Let me know in the comments section down below exactly what your opinion is of this. If you're American, how do you think we're going to do it? How do you think? Come up with a solution, put it down in the comment section. If you're in another country, let us know how you did it. So if you like my videos, give me a thumbs up, subscribe to the channel. If you have any questions at all, let me know.